Hi there, I'm Wendy Goyeneche and a student physical therapist assistant at Hearst University. How are you doing?
Good, how are you?
Well, I read that you're having some muscle spasms and your lower back, so we're gonna use traction to help you with that. So, are you okay with that? Okay, but first of all, we're gonna start go through some contraindications and precautions to see if you are qualified for traction. Okay. Okay. So, had you been instructed not to move your back?
No.
Had you had back surgery?
No.
Uh, have you dislocated a joint in that area?
No.
Are you pregnant?
No.
Do you suffer for high blood pressure?
No.
Do you have osteoarthritis, rheumatoid arthritis?
No.
Do you take steroids?
No.
Can you lay back on your back, stomach?
Yes.
Okay. Do you have TMJ problems?
No.
So now we're gonna go to a sensation test.
Okay.
And for that, I would like you to go lie on front, and then I'm gonna be around your lower back. So and I'm gonna. This is gonna be dull and sharp. Okay. So you're gonna tell me when you feel it. Okay. So this is
Sharp.
this is
Dull.
this is
Sharp.
this is
Dull.
this is
Sharp.
this is.
Dull.
Okay. So you're good.
Okay, so I'm gonna go over the parameters for the muscle spasm traction. It's gonna be a dynamic traction instead of static. So first, our maximal level is gonna be 25% of the body weight. So if my patient weighs 100 pounds, the maximal level will be 25 pounds. Minimal level will be 15 pounds. So that's set here. My treatments down here, progressive and regressive, are gonna be set to intermittent. So that way I have a dynamic traction setting. The time for this treatment is going to be 20 minutes. Set that. And then our hold and relax times will hold that stretch for 5 seconds. Then the patient will be able to rest and the pulling will stop for 5 seconds. So that ratio will be a 1 and 1. All right, and then after all your parameters are set for traction, we're gonna check our cords and make sure all of our cords are intact. Looks good.
Hi Becca, Maida. I am your SPTA today and we're going to do some traction for those muscle spasms you've been having. Alright, so I'm going to help you lay down here. Alright, so keep your legs together. There you go. Alright. Make sure these are right at the lumbar area. And we're going to ask our patient to breathe in and then breathe out. So I'll let you know when you will be doing that for me. Let me just get these straps together here. All right. Can you breathe in? All right. Give me a good breathe out. All right. How does that feel? Tight. Good. Not painful tight, right? Okay. So do another breathe in and breathe out. All right, how does that feel? Okay. While we do this, we want to make sure that our table is locked. Make sure our patient's not moving. All right, how does that feel? Good. Good? All right. Where's our bench? Wendy, could you help me with the bench, please? Want to keep our patient's legs together because again it's a back pain. So we're going to put rope release so we can clip this on here. Okay. Now, all right. As we continue, make sure that the ring is right at their belly button area, and we're going to get the strap right here, and we're going to hook it onto that ring, and we're going to have our rope released, and so that way we can attach it to this bottom ring. Okay. All right. Before I walk away, are you okay?
Yes.
All right. Hey, Becca, I'm going to give you this call switch. All right. Make sure that if your pain worsens, or you feel no pain at all, make sure you press on that button, okay? Or you can just call me Hey You. All right?
Okay, so now we're going to be starting the traction. So I'm going to go ahead and press start. You're going to feel the rope click back there. I'm going to stay with you through this first one. It's going to be pulling for 5 seconds and it's going to relax for 5. All right, now it's holding 4, 3, 2, 1. Okay, now it's going back down. Did that feel okay? All right, so now that the first cycle is done, I'm going to go ahead and unlock the table so that way it can shift there. You feel it? Okay, and then now that we would be doing this for 10 minutes, so I would come back in 5 minutes, check how are you doing, feels okay, all right. So then to take it to, let's pretend that it's completely done. I'm gonna go ahead and press stop. And you have to wait for it to pull back down. Do you still feel it? Perfect. And then the first thing you're going to do is release the rope. Just like that. And then you're going to make sure to lock the table again. So that way the patient doesn't move around. Just like that. And then you can take the call switch back. Just like that. And I'll have you lift your legs up. Like that. You can come over here if you can't see. Oh yeah. Okay, and then you're gonna have the patient do some ankle pumps for us, get the blood flowing. And you want to try to keep their back as straight as possible. So I'll have you go ahead and roll over to your side. And then I'll lift it up just like that. How are you feeling? Feel okay? All right.